Good afternoon. It's 2 o'clock now, so we will get started. And hello, everyone. Welcome to this webinar with Dan Cruz from the University of New Brunswick on the impact of nearby green spaces on health. And again, thank you for joining us. My name is Sarah Fortin. I'm the Knowledge Transfer Coordinator for the Canadian Research Data Center Network, the CRDCN. I would take a few minutes before I introduce our speaker for today, just to present briefly the network for those of you who may not be familiar with the network yet. Next slide, please. So the CRDCN is a partnership between a consortium of over 30 universities across Canada, together with Statistics Canada, supported by SSHRC, CIHR, and the CFI, the Canadian Foundation for Innovation. So as you can see on the map here, it's truly a pan-Canadian network, now comprising 30 facilities across the country. And it is also recognized as a major scientific infrastructure by the CFI. 2 new branches opened recently, over the last 12 months actually, in Nipissing and the University of Northern British Columbia. And 2 branches, if all goes well, will open next fall. So as you may know, research data centers, so the 30 research data that comprise the network, are actually secure computer labs where a researcher with an approved project can access Statistics Canada confidential microdata from a variety of surveys, including longitudinal surveys, of course the census data, and increasingly administrative data sets from federal and provincial governments. Last year, over 1,500 researchers from various disciplines, economics, sociology, demography, epidemiology, have accessed an RDC, and about a third of these users were graduate students. As you can imagine, the research carried through the network is diverse and have helped to better understand social and economic developments affecting the whole society, as well as the factor affecting individual life course and well-being. This includes, among other issues, population aging, economic integration of immigrants, socio-economic determinants of health, income inequality, labor market participation, and child development. So to know more about us, I invite you to visit our website. The address is just shown here. And without further ado, I will introduce our speaker for today. Please, next slide. So Dan is a health geographer and a research associate in the Department of Sociology at the University of New Brunswick. His key research focus is on environmental determinants of health. He's notably interested in how different groups of the population experience differential levels of exposure to pollution, and how this leads to different patterns of mortality and disease incidence. So today's presentation is actually a very recent publication, I believe in 2017. Next slide, please. Dan will speak for about 40-45 minutes, and then we will have a Q&A session. During his presentation, all mics will be muted. So do not expect to be able to speak while he's talking. Next, so I invite you to ask a question, to write them out by clicking on your control panel. You should see this little white arrow in an orange square. So if it's not open, you click on this, and then you will see the question tab where you can write down your question. And then I will, when the time comes, I will read the question for you. Next slide, please. In concluding, I just wanted to again thank you and say that all our webinars will be available afterwards, so including Dan's, but if you wish to see what we've done in the past, you can just visit our YouTube channel. And I also invite you to know what's coming, to register to our new newsletter, which is called the Networker. So we thank you, Dan, for being with us. And now, Mike, is over to you.
Okay, thank you. I will close your presentation and open mine. Okay. Well, thank you very much for that introduction, and thank you very much to the network for giving me this opportunity to talk about my study, and thanks to people for taking the time to tune in to hear about this. So I'm going to start by giving a little bit of background on this topic of benefits to health associated with contact with nature and interacting with nature and exposure to nature, things, this broad topic. And then I'm going to talk in greater detail about some of my studies that are looking into this using some Canadian national cohort data. So this topic of nature health interconnections is not a new topic by any means, but it seems to be a fairly hot topic right now. I'm not too sure what's caused a resurgence of interest, but anyway, there's a number of different studies over the years and in different places have found a number of different kinds of benefits to health, and I've listed associated with, as I say, contact with nature or interacting with nature and so on. And I've listed these on the screen. So ranging from benefits to self-perceived mental health and well-being, physical health, things like reduced blood pressure and reduced stress, improved sleep, benefits to mental health and cognitive functioning, reductions in obesity and increased physical activity, increased social interactions and neighborhood social cohesion. This is one that people don't often think about, but yeah, having how not just your own personal health and or physical health, but also fostering social interactions and things like that, as well as reductions in mortality rates. So there's a number of different ways of conceptualizing exposure to nature, and in many ways, a lot of the different studies that have looked at some of these outcomes are really like comparing apples and oranges, and they're really looking at different kinds of ways of measuring nature. And so I've just listed here again some other examples of some of the different kinds of study designs that have been used in the past. So for example, there have been studies that have looked at whether from where someone lives, how close is the nearest park or wilderness area. So the proximity of a park to where someone lives, and then maybe looking at, okay, do people who live near to a park, are they more or less likely to exercise? And that's a totally valid study design, but it's completely different from other studies that might use questionnaires or surveys to ask people, well, how much time do you spend outdoors? So there's not necessarily any kind of physical proximity or geography there, just do you spend time outdoors? And these are two just very different ways of conceptualizing how people might spend time in nature, be exposed to nature. Other studies, well, the studies that I'm going to describe here are really just describing the quantity of green vegetation around someone's home or within their community. And then there are some other neat studies that I'll talk about it in a minute, where they've just looked at having views of nature from one's window. So not necessarily spending time in nature, but just having a view of it and how that might lead to better mental health or things like that. And this is, and other ones are counts of purposeful visits to parks or natural areas. So where people are choosing to spend time in nature, not just having the opportunity because it's near them, but they're people that choose to spend time in nature. So next, I'm just going to talk about 3 different studies that are quite different, but that I found really fascinating and helped get me interested and motivated in kind of pursuing this kind of study. So this is a relatively older study from 2001, where these researchers in Ann Arbor, Michigan, did interviews with residents in 6 different apartment complexes. And so all of these apartment complexes were single unit apartments, maximum 3 stories, and they were all sort of low to medium income rents or residents. So they were fairly similar, and they're in this fairly small community or city of Ann Arbor. And so the apartment complexes were located in different parts of the city, and some of them backed onto onto a wood lot. Some of them had, some people's views from their windows were of parking lots, others were of gardens, some of them were just of another building. So they were quite variable, the kinds of views. And they did detailed interviews with the people and evaluated the kinds of views that they were having, and found that being able to have a view of natural settings from their window really contributed to satisfaction with their neighborhood and with their community, and with a number of different indicators of well-being, things like being able to concentrate and feeling good and feeling happy, things like this. And so this had nothing to do with actually going out and spending time in nature or breathing in the clean air that you would experience if you're in the wilderness or something like this. It's really just a view from one's home, and how that can make them feel better. So this is another study. This was a study based out of Toronto from just a couple of years ago, and it got a fair amount of media attention, so people might be familiar with this. So what these researchers did, which I think it's fascinating and it's really clever, was they were able to quantify benefits to health associated with the number of trees in their block. And so the city of Toronto has a database of all the city trees that are located along streets. So these aren't trees that are in people's backyards or in parks, but public trees that are along the roadways. And they know the exact location of these, and they were able to link up this tree data with data from the Ontario Health Survey. And so they interviewed 31,000 adults and found that by having 11 or more trees in a given block decreased cardiometabolic conditions in a way that was sort of equivalent to increasing someone's income by about $20,000 and then moving to a neighborhood with a much higher median income, or the equivalent of being about 1.5 years younger. So I thought that was a really cool study. And then lastly, another study that I found really interesting that just got me more thinking about this topic was a study from Wellington, New Zealand. And here what the researchers did was they wanted to get an idea of, from different locations around the city where people lived, if they had, what was the likelihood that they had a view of water or of green space. And so they took into consideration elevation and building footprints and distance and slope relative to all these different locations, and were able to come up with an index of visibility of blue space, i.e. water, or green space. And here they found that people that were living with increased views of blue spaces, so water, open water, had lower psychological distress levels. However, they didn't find any association with green space in that study. So having a view of water was beneficial to reducing stress, but in this study, the green space didn't really seem to matter. So how might green space benefit and contact with nature benefit health and well-being? So there are, and this is just an oversimplification, but there are three main hypothesized pathways or mechanisms through which we might experience benefits. And so the first is through harm reduction. And so if you think about an area that's got a lot of green space around it, it's going to have an absence of a lot of negative risk factors for health. So by having a lot of trees around where someone lives, you're likely to have maybe less noise from traffic. Areas that have a lot of, if you're in a more treed area, then you're probably in an area where there's less traffic, so maybe lower levels of air pollution. Trees and vegetation can help clean the air. They can lead to protection from providing some cooling on high heat days, and reductions in exposure to noise. So that's sort of those are all ways that having a lot of trees around, a lot of vegetation can reduce harm. It can also help in restoring capacities. So helping bring people back up to where, from a stressed state to a less stressed state. And so this has to do with stress reduction and attention restoration. Then the last pathway or mechanism is by building capacities and providing opportunities. So areas of green space around where people live can often provide maybe safe and accessible and appealing locations for exercising or for getting physical activity or spending time outdoors, and for helping to foster social cohesion and opportunities for social interaction with friends and neighbors and just people in the community. So with that sort of background on this topic and how this sort of works, I'm going to go into a bit of detail on two of my studies, looking at associations between risk of mortality and then residential exposure, so exposures around where people live to greenness and to major water bodies. So for my study, I used the 2001 Canadian Census Health and Environment cohort. So this is the CAN check, and anyone who knows me knows that I love to talk about the CAN check. So this is an amazing data resource that's available in your local RDC, and so it's available to anyone. Well, not anyone, but anyone who can get access to a research data center. And so this is the core of this is respondents to the 2001 mandatory long-form census. So as I would think most people are aware, the long-form census has pages and pages of information on respondents' age and sex and education and income and languages spoken at home and immigrant status and all kinds of socioeconomic and demographic characteristics, marital status. And so these were respondents in 2001, and they've been linked to the Canadian mortality database with follow-up for 10 years. So from 2001 through to 2011. So for all these people, we know who died and what did they die of. And then they've also been linked to their annual income tax filings. So all Canadian adults are required to file income tax. And so with that, we get an annual postal code. So we can know that at baseline, when the census came out, a given person was, say, living in a given neighborhood in Montreal, and then 2 years later, they moved to another neighborhood, and then 4 years later, they moved to Vancouver, for example. So we can track them for the purposes of assigning environmental exposures. And so then I've just shown here on this graphic just to indicate that along with these data that are built into it, so myself and my team, we've added a number of different contextual or neighborhood variables to describe the kinds of communities and neighborhoods where people live. So things like the median household income or the percentage of adults who haven't completed high school and population density, things like this, as well as different environmental exposures like air pollution and the amount of, and then I'll explain in more detail how we assign the greenness and the blue space. And then I just add the ellipsis there just to show that the possibilities are, kind of endless for the different kinds of environmental exposures that can be linked up with this cohort. So just to reiterate, this is the 2001 CAN check, and I should just, in case anyone's interested, there is Statistics Canada has prepared equivalent data sets with the 1991 CAN check, which has been available for a few years, and recently 1996 and 2006, and I don't believe that those are available in RDCs yet, but StatsCan is working on that. In any case, so for my particular study, I restricted it to non-immigrants because immigrants tend to have very different health behaviors and health outcomes than do the Canadian-born population. And so I excluded them from this study. It's limited to adults. And for this study, I also restricted it to people living in the 30 largest CMAs. So a CMA is a census metropolitan area. So these are cities with populations greater than 100,000. And for this, just my thought was that if you've got a lot of greenness around you and you live in a rural area, that's kind of a completely different kind of, well, lifestyle and exposure than if you're someone who lives in Toronto and you happen to be in an area where there's a lot of greenness around you. I really wanted to treat this as an urban topic or an urban study. And so my functional cohort was about 1.3 million subjects. And so I'm just showing on this map here, the red dots are the 30 cities that were included in the study, or studies, the blue space and green space. So you can see I've got cities right across the country. We've got all provinces represented except for PEI. Charlottetown is not 100,000, and quite a few in southwestern Ontario. So for estimating greenness, what I used was the Normalized Difference Vegetation Index. So this is the NDVI, and this is a satellite-derived indicator of the presence of green vegetation on the ground. And so the NDVI has a theoretical range from -1 to 1, where a value of 0, corresponds to sort of just barren land, and 1 would be dense, lush green vegetation, and then the -1 represents over water. So for my study, I rescaled this or trimmed it down to be just from 0 to 1. I didn't want to get the blue space. I wanted to treat it totally separately, and plus the NDVI data tend to be a little bit incomplete over bodies of water, so I didn't think that was the best way of capturing water. So anyway, for my purposes, I've scaled it to a value from 0 to 1. And so here's what it looks like. And so this is, I took the mean values of this NDVI over the study period. Now, when I started this study, there were no data available earlier than 2002. My cohort started in 2001, but so anyway, this is the average over that 10-year period. And these are at a spatial resolution of 250 meters by 250 meters. So it's a whole bunch of little grid cells that are 250 meters in size. Now, I've shown this map here of the Maritimes because that's where I am in Fredericton, but this isn't really a great location for demonstrating variability in green space because it's pretty much all green here. There's not much urban area. But if you look closely, or you don't have to look too closely, but you can see a few little areas that show up like Moncton and Halifax, where there's a little bit of yellow happening, and St. John and some other spots. So those are areas that are less green and less forested. So let's zoom in to another area so you can see a little bit more of the kind of variability we would see within a city. So here, this is the Ottawa-Gatineau area, and the red lines I've traced over top there are just the major highways around there. And you can see now that you can see it's a little bit blocky. You can so you can start to see the little grid cells that are indicating the intensity of greenness or less intensity of greenness. I'm just going to go back. I'm just going to bring this back. Because okay, so there you can see that in the downtown area, there's a lot less green. And then as you get out into the outside of the core there is where we start to get more greenness. So these white dots that were there, and I want them to come back. These are the postal code locations for subjects. So as you would expect, there's great concentration in the more urban parts and fewer out as we get away. And so the way I would assign exposure is just take where these points are and assign the greenness value, the NDVI, from that location. So I'm going to zoom in even further now, just so you can see what it looks like sort of at a neighborhood level. So where this star is here, this blue star at the top right, that is Statistics Canada's head office in it's not downtown Ottawa, but west of downtown, in the area known as Tunney's Pasture. So Tunney's Pasture, for anyone who's not familiar, is kind of a government campus where a bunch of office buildings are there. And here the black dots represent postal code locations. And so around Tunney's Pasture up there, there's not really any residences, so that's why there's no points there. And then sort of across the top of the screen there where it's greener, that's the John A. Macdonald Parkway. And so for anyone who's been along there, it's a lovely green, it's not like a normal highway, it's like a lovely green parkland along both sides of it, and biking trails and so on. And then sort of near the bottom of the screen and to the right is getting into Parkdale and Westboro, or Wellington West. Been a little while now since I've been there. But it's a much more built up urban area. And so you can, the idea here is you can see the size of what these grid cells look like, and just to get the idea that there is variability between just a few blocks. You know, somebody could be if you're living in one neighborhood compared to a few blocks over, the estimated greenness could be quite different. So that's, anyway, so that's how I assigned the green space to the subjects' postal codes and then updated this each year as they moved around. And so now I'll talk about how I estimated the exposures to blue space. So here, this is another area in Ottawa. So Carleton University is there at the west, and this is Old Ottawa South. It's in the middle of the screen with the Rideau Canal and Dow's Lake up at the top left. So what I did is I took, and the black dots here again correspond to postal code locations. So what I did here is I took for all major natural water bodies in Canada, so coastlines, ocean coastlines, lakes and rivers, and then I did a buffer around these of 250 meters. And so this image here, which looks like there's been some flooding, is just sort of indicating that's how far, that's what 250 meters looks like from Dow's Lake and the canal here, and how you can see here that the postal codes that are within that distance would be assigned as being near water. And so I took 250 meters as, I mean, I realize that's an arbitrary distance, but I meant for that to sort of roughly capture people that likely have a view of water either from their home or likely during their day-to-day leaving their homes, going around their properties, and so on. And they may have a view of it. They may be able, if you're that close to the ocean or a larger body of water, you may be able to hear it or smell it, or yeah. So what I wanted to do was some survival modeling, which is looking at how does the risk of mortality relate to the amount of greenness or living near blue space, with the idea that the hypothesis that those who have more green space around where they live or that do live near water are going to have lower risks of dying. And so I've just put this slide up for people who may not be familiar with how to interpret a hazard ratio. So when you get a hazard ratio of 1, this means there's no association between your given exposure and your outcome. And then, so a hazard ratio of 2 would be sort of a doubling of the risk of dying per whatever the increment is in exposure, or being exposed versus not exposed. And then correspondingly, as hazard ratios that are smaller than 0 are demonstrating a reduced risk. And so I'll come back to this after. So in my survival models, I adjusted for a number of personal and area variables. So as I explained earlier about the cohort, I had information on all kinds of socio-demographic and socioeconomic characteristics of the subjects, and then a number of different characteristics about the communities in which they were living. So what the actual city was, percentage of adults who hadn't completed high school, who were unemployed and had low income, as well as population density. And then from some other studies, I had estimates of ambient exposures to fine particulate matter, ozone, and nitrogen dioxide. Okay, so now I will move on to some results. So here I'm just showing some descriptive statistics about the exposures. So at the top left there, recall that the greenness had a range from 0 to 1, with 1 being most green. So on average, overall of all subjects, people had about a 0.58 on the NDVI. And then I'm just showing in this other little table on the right that there was some evidence of inequalities by socioeconomic status in terms of exposures. So among people in the lowest income quintile, they tended to have below average exposures to greenness around where they lived. And those in the highest income quintile were above average. And then the same pattern was present according to educational attainment. So those who hadn't completed high school tended to have sort of below average levels of greenness around their homes, and those with university degrees or more were above average. And this could be, well, I'm just going to leave it there for now. So here I'm going to show this. I'm showing the associations that that I found with 3 of the causes of death that I looked at. I looked at a bunch of others, but I'm just showing 3 here. So these hazard ratios were computed per the interquartile range. So this means, which was 0.15. So in the case of non-accidental mortality, so dying from anything other than accidents, I found that for each increase of 0.15 in NDVI, there was an approximate reduction in the risk of dying of about 8.5%. And so to put that IQR, the 0.15 in context, so that's sort of the difference. That reduction of 8.5 is sort of the equivalent of somebody living in an area where the greenness is about a 60 compared to somewhere where it's 75, or somebody living where it's compared to living where it's 45 and 60. So for that incremental jump in your exposure, with more greenness, we're seeing about an 8.5 reduced risk of dying. And so when I talk about this, sometimes people say, well, what do you mean reducing the risk of dying? Everybody's going to die, which is true. So the way you can think about this is, imagine if you had 2 groups, let's say 2 groups of 1,000 people each, or 5,000 each, whatever, and they have a relatively equal distribution of characteristics among them. So about the same number of people in different age categories, same number of men and women, same number of people that are highly educated, same number of people that are married and single, and so on and so forth. And then you've also got, so keeping in mind all the variables that I had in my statistical model, so about the same number of people in big cities and small cities, the same number of people living in dense neighborhoods and less dense neighborhoods, and with high levels of pollution and so on. So you've got these 2 groups that are more or less equal, except the one group, they are all smokers, and the other group are not smokers. You can imagine that after 10 years, the group of smokers, a lot more of them will have died. And so this is the same kind of thing where we've controlled for and adjusted for all these other characteristics, with the difference being the greenness exposure. And so those that have the more greenness exposure are less likely to have died over that 10-year period. So here's, I know there's a lot of numbers on the screen here. You don't need to see all of that. You don't need to take it all in. But what I wanted to show is that we did find some evidence of social gradient in health. And so what I'm showing here at the top, this was at the very top there, the 0.92 was the hazard ratio for all subjects. This is for non-accidental mortality. And then when I break it down by different subgroups, we see that, well, among men, for the same level of exposure, they had much greater benefit, so much lower hazard ratio than for women. And then similarly, by education and by income quintile, you can see that for each increased level of education, there was a more protective effect. So the hazard ratios are smaller, or less than, further away from 0, with each increase in education, and also with each increase in income quintile, such that among people in the lowest income quintile, they're not seeing any benefit to their health at all. So the way this could be explained a little bit, or perhaps, is that if you recall, the measure of greenness was really just the quantity of green vegetation, but there was nothing about the quality or characteristics of the green vegetation around where people live. So for more affluent people, maybe the kind of green space around their homes is maybe more interesting gardens and manicured yards and interesting shrubbery, and in the amounts of equivalent amount of green space in another neighborhood could really be just some grass. And so it's not as much of an interesting or useful space, perhaps, for a spot that doesn't maybe encourage people to spend time in it. More affluent people may also have more time, more true leisure time to spend around their properties, or they may be more interested in gardening and spending time outdoors on their property. So the way people interact, so the quality and characteristics of the green space between affluent and less affluent neighborhoods can vary, and also the way people interact with these spaces could vary. And so that could lead to these differences in benefits to health. So I'm just showing here, this is a concentration response curve. So across the bottom there, across the x-axis, that's the greenness, so it goes from 0 to 1. And then up the y-axis, these are the hazard ratios. And so it's not a perfectly linear, kind of plateaus. So once you get up to around 0.7, if you're living in an area where the amount of green space around your home is around a 0.7, whether it's 0.7, 0.75, 0.8, 0.85, there's not that much of a difference anymore. It kind of plateaus around there. So that's the significance of that plot. So some of the key findings here, well, I found pretty strong protective effects for several causes of death associated with these residential exposures to greenness. And it's in a really big, really large cohort, and that I was able to control for a lot of, as I've described, a lot of personal characteristics as well as these different contextual and environmental characteristics. And then another key finding was that these different associations by socioeconomic position. So more affluent populations tended to have slightly greater exposures to greenness, but also increases in benefits to their health. So now we'll move on to blue space. Some results here. So here I'm just showing some descriptive statistics. These are the distributions, the percentages of people of different characteristics between the exposed groups, so those who are living near water and those who aren't living near water. So you can imagine with living near water, I think something that people might think of right away as well, the people that are living near water are probably going to be the more affluent people and people that can afford to live there. I mean, if you think about that, just that one little map of Ottawa where I showed there around Carleton University, I mean, the cost of those houses along the Rideau Canal are super expensive. And that would be the case, you know, waterfront properties anywhere are more expensive. And so there was a bit of concern that, well, maybe these people that are by the water are just not the same as the people that aren't by water, but the characteristics were actually quite similar. So I'm just showing here about the same number of people that hadn't completed high school among the exposed and the unexposed. Slightly more of the people near water had a university degree, but about the same number in the lowest income decile, and slightly more of the most affluent were living near water. As, you know, we would expect that. The only variable that was really notably different between the two was that among the people living near water, there were quite a bit more who weren't in the workforce. So they were either unemployed or just not in the, maybe they were retired, so they're not in the workforce anymore. And so here, this is another table that's similar to the one I showed earlier. As you can see, the associated reductions in mortality risk are quite a bit higher than what we saw with the green space. Excuse me. So, like in the case of cardiovascular disease and Alzheimer's, we're seeing an approximate reduction in risk of mortality of about 15%. And so I'm showing here, I decided to explore some other buffer sizes. So not just living within 250 meters, but also within 500 meters and up to a kilometer. And just to, you know, as you might expect, and I've just sort of highlighted here to approximate. So these red, the points that you're seeing are the point estimates, and then the bars are the confidence intervals. And so as we increase the size of the buffer, the associations are much more attenuated, such that living within a kilometer of one of these water bodies is barely, is not significantly protective for half of these causes, and only mildly protective for some of the others. So you really need to live much closer in order to get these benefits. So some of the key findings from from the blue space part is that, I mean, really there are no other studies like this one. So and blue space has been studied much, much less than green space. So we're really seeing here that residential exposures to blue space may have much stronger benefits to health than people had previously expected. And as I've said, I mean, I don't even know if some of these blue spaces are accessible. So, you know, this finding is sort of suggesting that just sort of everyday residential exposures to blue space may have important benefits to health that are sort of distinct from maybe having a purposeful visit to going to spend the day at the beach, for example. So some overall key strengths of both of these that are, include the very large sample size, the fact that it was national in scope. These exposure data were available in a consistent quality over time and across the whole country. I mean, if I was going to do a study in, say, just Vancouver, I could probably get, you know, or in just one city, I could probably get some higher quality water data where I could differentiate between ocean and lake and river and maybe look more closely at, you know, would someone actually have a sight line of this or have access to it. But to do that nationally isn't really an option. So, you know, these data were available all over. And then, as I've said a couple times, controlling for many different personal and environmental factors. And so some limitations, as I've already said, that the 250 meters was a relatively arbitrary distance. I didn't go into it all here, but I did also look at the 500 meter buffers and 1 kilometer buffers just to see how the associations varied at these different scales. And then, as I've also noted, that the greenness in particular is really only describing the amount of green vegetation and not the quality of it or accessibility of it. And the same with the water, it's not necessarily accessible or visible from where people live. So some remaining questions in this field or on this topic are dose response relationships. So, you know, these would vary depending on the outcome of interest. So, for example, what's more relevant to health? Going and spending, say, half an hour in a park 3 days a week, or going and spending all day in the woods on the weekend where you're getting an intense exposure and dosage to nature. And I mean, that might differ for mental health or quality of sleep. You know, different outcomes are going to require different relationships or different doses. The spatial scales of exposure. So, you know, I've already alluded to this a little bit. I mean, depending on the outcome you're looking at. I mean, for here, I was hypothesizing that the benefits to health are going to be more related to stress reduction. The benefits to mortality would be achieved through stress reduction and so on. And so I wanted to consider just the kind of residential exposures, what people are going to see when they step out of their property, when they look out their windows. But if I were studying physical activity, it might be more relevant to know, well, it's not just what kind of greenness is around your house, but what kind of parks are there in your community? How much greenness is there in your overall community, in your whole neighborhood, not just around your house? So, and I mean, of course, people don't spend all their time at their house. You spend time in your neighborhood, and so the kinds of environments in your whole neighborhood might be more relevant than just the kinds of environments right around your house. As well, there's a lot of opportunity to look at different kinds of environments. So maybe here differentiating between the different kinds of green space. So is something a park? Is it a woodlot? Is it just a cornfield? Is it a cemetery would show up as a big area of green space, but that's not really a spot where anybody's going for physical activity, say. And then we still need a lot of work on effect modification. So trying to get a better understanding of why we're seeing different benefits among men and women and people of different age groups and socioeconomic position. So here's a long list of my collaborators and supporters who have worked on this with me. And then, so yeah, the green space paper was published last year, and so it's out there, and the blue space is still being worked on, and it's not out yet. So that's all I have.
Thank you, Dan. That was great, very informative, very exciting. If I may start, if you can go back one slide previous to that one.
Yeah.
I invite you to add the CRDCN among your partners.
Okay.
Because of course this is very important to us, and this is a very interesting study, so please add it. So I've asked people to write their question, and actually I have one already, so I will start with Aviroup Biswa. I'm sorry, I'm gonna open the question. Aviroup, I'm sorry if I mispronounce your name, forgive me. So here's the question, Dan.
Yeah.
Can you see it yourself? So here,
Nope.
here it goes for the others. Are all green and blue spaces created equally? Good question. Can you suggest if there are differences in mortality and disease risk based on the quality and characteristic of the green and blue spaces? And it goes on saying, to support policy implementation considerations, is there a plan to quantify green and blue space by different characteristics?
So I think I alluded, that was that the whole question?
Yeah.
Yeah, I think I alluded to a little bit of that near the end of my talk, and that's really the next stages of where to take this. And for the blue space, I wanted to do that. I wanted to try to differentiate rather than just saying, okay, you live near water. We tried splitting it up and saying, okay, well, let's categorize and say, okay, you live near ocean, or you live near a lake, or you live near a river. And then we thought, well, you know, the Great Lakes, if there's some spots where you're living near a Great Lake, it's kind of like the ocean. So then we thought, well, I don't know, should we split the lakes into two categories, like big lakes and versus smaller lakes? And then we also started looking at places like, well, around Vancouver, for example, like the Fraser River. If you're on that, you know, it's pretty much the ocean. So we basically found like there wasn't we didn't have a defensible data set that was very clearly defining what these, you know, ocean versus lake, and how, you know, how do you cut off big lake versus small lake and so on. Yeah. So we just left it, you know, as just water for now, and then that would be something I'd like to pursue, not at the national scale, because it would be just too hard to try to quantify all these different water bodies, but maybe around, say, the three major cities, spend a bit more time.
A given area. Yeah, actually, that's interesting because myself, I live nearby, not an ocean, not something like the big lake, but beside the Richelieu River, actually, and it's the Bassin de Chambly. And yeah, while you were talking, I was thinking to myself, well, isn't there more green space around blue space by definition? Maybe not always, but that's something that, and I was surprised by your result that the blue space doesn't seem to be more protective, as I would expect, right? Because normally you protect your, how you call it, les berges en français, so you try to protect the area around the river so that the river doesn't go down. Yeah. So you have more trees, and but anyway, I leave it to you. Is that something that you think about at all?
Well, in the not really, I guess.
Food for thought.
Yeah.
Okay.
Yeah. But and just to answer that first question too, I mean, it's the same with the green space. That's something next to do, is to try to differentiate between the quality and so on, or the characteristics and the kinds of green space. Yeah.
Okay. So I guess I have a follow-up question from Aviroup. And here it goes. Have you thought about using the longitudinal data to examine differences in the mortality and disease incidence associated based on changes in green spaces over time?
No, you're getting all the good questions, all the great ideas, though. Yeah, that's another thing I wanted to do was, well, related to that, what I've been trying to figure out a way of doing, and I need a bit of a longer follow-up period, is to look at people who have, say, lived near water for, say, 5 years, or a longer period of time, or people that who've never lived near water for a longer period of time. And I think that would strengthen the relationship. I mean, here I've got people moving every year, and with only 10 years, it was a little tricky. But likewise, I want to look at people that move to green spaces and away from green spaces and see how does that change. And I think what I would use would be another data set, maybe the Canadian Community Health Survey, where there's things maybe on mental health. I think it's unlikely that such a short-term move would be associated with mortality, but you could look at, people who've recently moved to green areas, if that's had benefits to health, or moved away. I don't know. I think that answers. I don't know if that answers the question. The question was a bit more about changes to green space. I was thinking more about people getting a change in their exposure due to their mobility.
Exactly. Following people when they're moving from a greener space, and actually we can even wonder whether someone living in the city would like to move to a greener space because it's not feeling well, actually, and getting better when they get to. So there's also this problem. I invite you guys who are listening to us to write a question. I have no other question listed here, but I have one I'm going to try you again. I'm sorry. I hope I don't ask you questions that make you feel uncomfortable, but it struck me when you and it was really interesting, the mapping and things. It's really visual presentation, and it's helpful for us to think. And it struck me when you mentioned StatCan, which I know personally because I've been there, and it seems like a desert actually. And I was thinking, beside residing somewhere, does working in a more green environment, I understand you have not done it, but maybe you know about, is this something that we should think about as well?
Yeah, I don't have any. I don't have any studies that I know about that are like that, but it's amazing that studies like mine and so much of the Canadian air pollution research and international air pollution research, I mean, we're just going by where people live. And as we know, you don't spend all your time at home. And so it's amazing that we can still get these strong, statistically significant associations based on just where someone lives. Because, many people, especially in big cities, can live out in the suburbs where it's lovely and green and low levels of air pollution and no congestion and so on, but then they spend an hour commuting, and then they're in the downtown core where it's noisy, and they might have more adverse environmental exposures and no green space or whatever. But yeah, that would be another. I think StatCan has recently linked to CanCheck work locations. So that would be another future opportunity, would be to incorporate, sort of give a weighted exposure, like, some proportion of the exposure is based on where you live and some is based on where you work. But it gets complicated because you've got a lot of people that are sort of mobile where they work. People that drive delivery vehicles, or, plumbers and so on that are not based in an office all day. It gets really complicated when you try to take into, or taxi drivers, obviously, if you try to take into consideration, work.
I understand, but I guess that's the challenge that we're looking for as a researcher. All right, thank you. I don't have any other question from our participants yet. I might try something. I wonder if, but not everyone has necessarily a mic. So I was going to say I'm going to open it up to everyone to ask a question. But I wonder. So let me try. If I open up the mics. if it works. In any case, I think I have to do it by hand. So Ashley, you're open if you wish to talk. Avirup also, Emma, Grant, Gibson, James, Dunbar. So there are so few of us today. I'm taking a chance to try. Okay. So everyone is now, the line is open for you guys. If you wish to ask a question directly, I'm going to give you a few seconds. Someone is alive there. Okay, I don't think it works. Dan?
I can.
Thank you very much. Very interesting, very promising for the rest of your work. And I look forward to do another one with you shortly, hopefully. And for you guys, thank you for joining us. I just wanted to mention that the next webinar will be on June 19 with Chuck Blount. We'll be discussing on quite a different topic, but still quite interesting. So how to combat poverty, and he's looking at how Quebec did it and compared to BC and Ontario and Alberta, actually. And also I wanted to mention that the annual conference of the network, the call for proposal is now out. I invite you to join us in Hamilton on October 18 and 19 next fall. Everything is available on our website, so you just have to send your proposal. And I look forward to eventually meeting you there. Again, Dan, thank you very much. Oh, maybe one thing I wanted to mention is that we've prepared, actually my colleague, Grant Gibson, who is on the line right now, prepared with the help of Dan, a research highlight. And so it does summarize the main findings of this paper that you've done. And it's available on our website if you wish to have a look at it. Again, thank you and see you next time.